Welcome to Simplified Health Tips, your place for factual information about achieving and maintaining optimal health. I'm Michael. Today Russell and I will be covering everything you need to know about coronary artery disease, including its causes, symptoms and treatment options. So, tap the like button, smash that subscribe button and let's go. First off, Russell, what is coronary artery disease?
In the human body, the coronary arteries are vessels that are tasked with the supply of oxygen, nutrients, and blood to your heart. A coronary artery disease is one in which there's severe damage to these vessels. Plaques, which are deposits containing cholesterol, and inflammation, are some of the most popular causes of coronary artery disease. When the plaque accumulates in your artery, it leads to a narrowing of the artery, which will result in a significant reduction of blood flow to the heart. Shortness of breath, angina, pain in the chest, and many more, may inevitably develop after some time. When the vessels become completely blocked, a heart attack may result, and this is often the most consistent sign that you have a coronary artery disease. However, you do not need to wait for a heart attack, which may become too late. You can now begin steps for treatment and prevention of these diseases. It is also very important to point out that living a healthy lifestyle may be your best option to avoid the disease.
What are the symptoms of coronary artery disease?
With the coronary artery disease, your arteries narrow significantly, and as such cannot supply blood rich in oxygen to your heart. It is even more dangerous when you engage in strenuous activities like exercises that will cause your heart to beat harder and faster. Initially, you may not notice any symptom, but as the arteries narrow further, the following symptoms may become more evident. Shortness of breath. When your heart is unable to pump blood sufficiently to the rest of your body as a result of this blockage, you may frequently experience shortness of breath and severe exhaustion when you engage in any physical activity. Angina, chest pain. When there is blockage in your arteries, you may feel a tightness, pain, or a knot in your chest. The pain might feel centralized to the left side or middle of the chest. More often than not, the major trigger of angina is stress, be it emotional or physical stress. Oftentimes, people report that the pain disappears after stopping the action that caused it. Heart attack. As we have stated, a totally blocked coronary artery will lead to a severe heart attack. Some of the most common signs that you are having a heart attack include pain located in your arm or shoulder. You may also experience fatigue and severe shortness of breath. It is important to note that heart attacks sometimes may not have any sign and symptom. Also, men are likely to experience the signs associated with heart attacks. Although women experience these symptoms, theirs may be reduced to nausea, shortness of breath and fatigue.
When should you consult a doctor?
It is always important to quickly call an emergency line when you notice even the slightest signs of a heart attack. However, if calling an emergency number is not possible, ask somebody to immediately drive you to the hospital. You should only get behind the wheel as your very last option. In the event you are at a high risk of developing a coronary artery disease, you should consult your doctor so as to get tested for any likelihood. A few of these risk factors include high cholesterol, high blood pressure, tobacco use, obesity, diabetes, or if there is a history of heart diseases in your family.
What are the causes of coronary heart diseases?
A coronary artery disease often begins when a damage to the inner layer of the artery occurs. This damage may begin as early as your childhood. There are several causes of the coronary artery disease. These include high cholesterol level, high blood pressure, smoking, living an inactive lifestyle or a sedentary lifestyle, diabetes or insulin resistance, and so many others. When the inner layer of the walls of the coronary artery is injured, plaques, which are deposits of fats, accumulate at the point of the injury. This accumulation of plaques is known as atherosclerosis. Additionally, if the surface of the accumulated plaque breaks, platelets will be deployed to try and heal the artery. These platelets may start clumping together and thereby block the artery, and this may lead to a heart attack.
What are the risk factors that may lead to coronary artery disease?
A few risk factors associated with coronary artery disease include age. The more you age, the more likely you are to develop coronary artery disease. High blood pressure. When your blood pressure is not kept in check, it can lead to hardening of your arteries, thereby having a narrowing effect on the area blood is supposed to flow, leading to an elevated blood pressure. Family history. If you come from a family with a history of heart diseases, you are at a much higher risk of developing coronary artery disease. This is even more likely if any of your close relatives was diagnosed with the disease at a young age. Diabetes. Type 2 diabetes has a lot in common with coronary artery disease, as they both have similar risk factors like high blood pressure and obesity. Smoking. Smoking significantly increases the risk of heart disease. Additionally, constantly inhaling secondhand smoke can also increase the risk of developing coronary artery disease. Sex. Generally, men run a higher risk of developing a coronary artery disease than women. Women, on the other hand, might become more vulnerable to this disease after menopause. Elevated blood cholesterol levels. An elevated cholesterol level in your blood can increase the risk of plaque formation and atherosclerosis. Prolonged stress. Prolonged stress is dangerous to your health and so may further injure your arteries as well as increase the risk factors associated with coronary artery disease. Obesity. When it comes to coronary artery disease, being overweight worsens the symptoms and increases other risk factors. Physical inactivity. Living a sedentary lifestyle, or living without sufficient physical exercise or activity also worsens coronary artery disease and most of its risk factors. Unhealthy diet. Your diet directly affects your health. Eating food with high quantities of saturated fat, salt, trans fat and sugar can worsen any existing risk of coronary artery disease. It is important to note that certain risk factors may occur at the same time, and may be as a result of one triggering the other. For example, excess weight or obesity might result in type 2 diabetes and an elevated blood pressure. In some cases, coronary artery disease may develop and none of the above risk factors may have triggered it. Several studies are currently being carried out to ascertain the probability of other risk factors in causing coronary artery disease. Some of these possible risk factors include high triglycerides. This type of fat, lipid, resides in your blood. Increased levels of this fat may increase the risk of coronary artery disease, especially among women. High sensitivity C-reactive protein, HSCRP. When an inflammation occurs in your body, this protein is often produced in larger amounts. Most researchers believe elevated HSCRP levels may lead to heart disease, and that the more the coronary arteries narrow, the more the quantity of HSCRP. Sleep apnea. This sleeping disorder often causes you to have unstable breathing during sleep. This leads to rapid reductions in the blood oxygen level. It also puts strain on your heart and elevates your blood pressure. Preeclampsia. This condition may lead to an elevated blood pressure, and it usually develops during pregnancy. This condition may also increase the risk of heart diseases as you get older. Homocysteine. This amino acid is often used by your body to make protein and to build and repair tissue. However, elevated levels of this amino acid may lead to coronary artery disease. Autoimmune diseases. Conditions like lupus, rheumatoid arthritis, and other inflammatory conditions may increase the risk of atherosclerosis. Alcohol use. Excess alcohol consumption may lead to damage or injury of the heart muscle, and may also worsen other risk factors.
What are some of the complications that having coronary artery disease may lead to?
In severe cases, coronary artery disease can result in heart attack. When a plaque ruptures, platelets will accumulate to form a blood clot, which may cause a blockage, and may eventually lead to a heart attack. Severe chest pain, angina. Severe chest pain is the most common complication of coronary artery disease. When the coronary artery narrows, it will reduce the amount of blood that the body receives. During any form of physical activity, the demand for blood is more, and so it puts great strain on your heart, which leads to the chest pain. Abnormal heart rhythm, arrhythmia. Irregular blood supply to the heart may negatively affect the heart's electrical impulses, leading to irregular heartbeat. Heart failure. In the event that a part of your heart is severely deprived of oxygen and nutrients, or if you have had a heart attack, the heart may become too weak to pump blood. This is referred to as a heart failure.
How is coronary artery disease diagnosed?
To give an accurate diagnosis, the doctor will require certain information concerning your medical history, run several blood tests, and carry out a physical examination. Other possible diagnostic tests include electrocardiogram, ECG. This machine is used to record electrical signals moving through your heart. It can also show any trace of past or present heart attacks. Echocardiogram. This device uses sound waves to display distinct pictures of your heart. Using an echocardiogram, your physician will be able to check if all the walls of your heart are working perfectly to ensure the entire heart works smoothly. If there is a particular wall that moves weakly, then it could have been previously damaged as a result of a heart attack. This could be indicative of coronary artery disease. Exercise stress test. If you experience symptoms while performing any exercise, your doctor may ask you to jog on a treadmill while using an echocardiogram. This is often referred to as a stress echo. The results are then studied. Nuclear stress test. This test shares a few similarities with the exercise stress test. The difference, however, is that in the nuclear stress test, pictures are included in the ECG. This test measures the amount of blood flow to your heart when you are resting, and when a stress stimulus has been introduced. Cardiac catheterization and angiogram. For cardiac catheterization, your doctor carefully inserts a sterile catheter directly into one of the arteries or veins around your neck, arm or groin and connects it straight to your heart. The doctor can then use X-rays to monitor the path of the catheter till it gets to the right position. To amplify the images, a dye is occasionally used. Cardiac CT scan. Your doctor can also carry out a CT scan of the entire heart to detect calcium deposits lodged in the walls of your arteries that may cause narrowing. Substantial amounts of calcium deposits could be indicative of coronary artery disease.
What are the available treatment options for anyone who has coronary artery disease?
Adequate treatment for this disease may involve several lifestyle changes, drugs and, if absolutely necessary, a medical procedure. Lifestyle changes. Committing to a strict and total lifestyle change could be instrumental in making your arteries significantly healthier. Exercise regularly. Reduce stress. Quit smoking. Lose excess weight. Eat healthy foods. Abstain from drug abuse. Additionally, several drugs can be taken in order to treat this disease. They include cholesterol-modifying medications. These drugs help to reduce the main material that makes up the deposit on the wall of the coronary arteries. Your doctor may decide to prescribe either niacin, stations, bile acid sequestrants, and fibrates. Aspirin. Your doctor may ask you to take a daily dose of aspirin or other blood thinners. This will help avoid narrowing by reducing the clotting ability of the blood cells. However, aspirin should only be taken after consulting your doctor. Beta blockers. Beta blockers are used in reducing your heart pressure. Beta blockers reduce the risk of any form of heart attack in the future. Calcium channel blockers. These medications can be taken with beta blockers if you haven't noticed any significant improvement with the beta blockers. These drugs also help relieve the symptoms of chest pain. Ranolazine. This drug helps people reduce the chest pain, angina. Your doctor might prescribe it with a beta blocker. Nitroglycerin. These tablets, patches and sprays can help you reduce angina by the dilation of the coronary artery. Angiotensin converting enzyme, ACE, inhibitors and angiotensin II receptor blockers, ARBs. These drugs may help significantly reduce blood pressure and may also reduce the symptoms of coronary artery disease.
What steps can we take to prevent developing coronary artery disease?
Interestingly, medical experts advise that healthy lifestyle habits used to treat coronary artery disease can also be used to prevent it. Living a healthy lifestyle is crucial to keeping your arteries healthy and free of plaques. In order to improve the overall health of your heart, you should consider staying active physically. Putting conditions like high cholesterol, diabetes, high blood pressure under control. Quitting smoking. Managing stress. Putting your weight in a healthy range. Eating a low-fat, low-salt diet. Also, include fruits, whole grains and vegetables to your diet.
Thank you again, Russell, for helping our viewers better understand coronary artery disease. To our viewers, remember to share this video with someone who may benefit from the information. Also leave your feedback and topic suggestions in the comment section. See you next time.
Thank you for watching to the end of our video. If you found the information helpful, please like the video. Also, don't forget to join the family by subscribing to our channel. See you next time.